Look, I'm going to be blunt with you right out of the gate. Somebody in America is having a stroke right now. Literally right now as you're watching this. It happens every 40 seconds. That's not a scare tactic. That's just the math. But here's the part nobody ever bothers to tell you. The vast majority of those strokes, we're talking up to 80%, didn't have to happen. They were preventable. Not treatable after the damage is done, preventable. Actually, genuinely stoppable before they ever occurred. And your brain? It tries to warn you. It sends you signals, sometimes hours ahead, sometimes days ahead, practically screaming that something is about to go very wrong inside your skull. But most people have absolutely no clue what those signals look like. They brush them off. They chalk it up to aging or being tired or needing a glass of water. And then the real event hits, and suddenly they're in an ambulance wondering what happened. Let me tell you about a guy I'll call Frank. 67 years old. Retired school teacher, not in terrible shape. One afternoon he's sitting in his recliner reading a book, and suddenly the vision in his left eye just goes black. No pain. No warning. Just darkness. Lasts maybe a minute and a half, then it clears up like nothing happened. Frank blinks a few times, looks around the room, and decides he probably stared at the page too long. Maybe he's dehydrated. He doesn't tell his wife. He doesn't call anybody. He goes back to his book. 3 days later, Frank has a massive ischemic stroke. He spends the next 4 months in a rehab facility. The left side of his body never fully comes back. What happened in that chair wasn't eye strain. It was a transient ischemic attack, a TIA, and it was his brain waving a giant red flag that he didn't recognize. If he'd driven to the ER that afternoon, instead of pouring himself a glass of water, we'd be telling a completely different story right now. My name is Dr. William Parker. I've been working in senior health for over 2 decades, and today I'm walking you through 7 warning signs that your brain might give you before a stroke. Not 5, 7, because I've added 2 that don't get talked about nearly enough, and they matter. This isn't about scaring you into paranoia. It's about giving you information that could literally save your life or the life of somebody sitting next to you right now. The data is crystal clear on this. People who catch these warning signs early and actually do something about them have dramatically better outcomes. It's not even close. I need you to stick with me through every single one of these. Warning sign number 4 is the one almost everybody writes off as nothing. And that's exactly why it's so deadly. Warning sign number 6 is one most doctors don't even bring up in routine checkups. And warning sign number 7 ties the whole thing together in a way that might fundamentally change how you think about your own health. If you've never been to this channel before, hit that subscribe button right now. This is what we do here. Straight talk, no fluff, science-backed information for adults who'd rather understand what's going on inside their body before a crisis forces them to learn the hard way. Let's get into it. The framework you need first, before I lay out the 7 signs. I need to give you some context. Because if you don't understand what's actually happening inside your blood vessels, the warning signs are just a list. They won't stick, and you won't act on them. I call this the silent buildup, and once you get it, everything else clicks into place. Here's what almost nobody understands about strokes. Let me break it down bluntly. Number 1, a stroke doesn't come out of nowhere. It just looks like it does. The moment you see someone's face droop, or their arm go limp, or their speech turn to mush, that's the finale. That's the last act of a process that's been quietly building inside their arteries for years, sometimes decades. Blood pressure running high for years has been slowly beating up the walls of those arteries, making them stiff and brittle. Elevated blood sugar has been eating away at the smooth inner lining of blood vessels. Cholesterol-laden plaque has been piling up in there like rust in old pipes. Abnormal heart rhythms have been letting blood pool and form clots. All of this has been happening with 0 symptoms. 0. The brain has been living under increasing threat for a long time before anything visible shows up on the outside. Number 2, your brain has basically 0 tolerance for losing blood flow. Your muscles can handle reduced oxygen for a while. Your brain cannot. Brain cells start dying within 4 to 6 minutes of being cut off from blood supply. Every single minute that a major stroke goes untreated, roughly 1.9 million neurons die. Let that number sink in. 1.9 million per minute. Time isn't just important in stroke response. Time is literally the only thing that matters. Number 3, and this is the one that kills people, because they don't hear it clearly enough, a TIA is not a dodged bullet. It is not your brain having a close call and then everything being fine. It is a direct, unmistakable warning that the main event may be right around the corner. Published research in the journal Stroke showed that roughly 10 to 15% of people who have a TIA will go on to have a full-blown stroke within 90 days. And here's the gut punch. Nearly half of those strokes happen within 48 hours of the TIA. 48 hours. 2 days. The warning and the catastrophe aren't separated by some comfortable buffer zone. They're separated by a ticking clock measured in hours. What happens during a TIA is straightforward. A small clot or chunk of plaque breaks loose, floats through your bloodstream, and temporarily plugs up a small vessel in the brain. The neurons downstream lose oxygen. You get a symptom: blurred vision, numb arm, garbled speech. Then the clot dissolves or shifts, blood flow comes back, the symptom disappears, and you feel perfectly normal. But the thing that created the clot in the first place, the damaged artery wall, the plaque buildup, the irregular heartbeat, that's all still there. It hasn't gone anywhere. And the next clot that breaks loose might not dissolve, it might not shift. And the chunk of brain tissue it starves might be a lot bigger. A major analysis from the American Heart Association confirmed that TIA patients who got rapid diagnostic workups, imaging, cardiac monitoring, the works, were far more likely to have a treatable root cause found and fixed before a major stroke could happen. The system works. The medicine works. The problem is that people don't show up soon enough because they don't know what they're looking at. Keep all of that in your head as we go through each warning sign. Before we move on, if you're finding this useful, do me a favor. Hit that like button, drop a comment. And if you haven't subscribed yet, now's the time. It takes 2 seconds, and it helps this content reach people who genuinely need it. Now I want you to do something. Think back over the last year or two. Not to some dramatic medical emergency, just to your regular life. Were there any moments that felt a little off? A few seconds of weird dizziness that came from nowhere. A moment where you reached for a word and it just wasn't there. A strange heaviness or tingling on one side that you noticed and then forgot about 10 minutes later. Moments you blamed on being tired, on stress, on just getting older. I'm not telling you those were TIAs. Most of them probably weren't. But after 21 years of doing this, I can tell you with absolute certainty that when people look back after a stroke, they almost always remember moments in the days or weeks before that they explained away. Not because they were stupid or negligent, because nobody had ever told them what to watch for. If any of that rings a bell, even a little, you're exactly who this video was made for. And here's the thing that should give you hope, not fear. The research on TIA intervention is some of the most encouraging data in all of cardiovascular medicine. A study in The Lancet found that when people who had a TIA got urgent evaluation and treatment within 24 hours, their 90-day stroke risk dropped by up to 80% compared to people who waited. 80%. That's not a marginal improvement. That's the difference between a normal life and a catastrophe. The warning signs are real. The window to act on them is real. And what you do inside that window determines everything that comes after. Warning sign #1. Temporary vision loss in one eye. This is what happened to Frank. It has a fancy medical name, amaurosis fugax. But all it means is that vision in one eye goes dark for a short time, usually seconds to a couple of minutes, and then comes back completely. No pain involved. Just sudden blackness, then normal again. And this is where people make the fatal mistake. They think, well, it came back, so obviously nothing serious happened. That interpretation could not be more wrong. That interpretation gets people killed. Here's what's actually going on. The ophthalmic artery is the blood vessel that feeds your eye, and it branches directly off the carotid artery, one of the main pipelines carrying blood from your heart up through your neck and into your brain. When a clot or a fragment of plaque temporarily blocks the ophthalmic artery, your eye loses blood supply and your vision goes dark. When the blockage clears, vision returns. But that clot didn't come from your eye. It came from the same vascular system that feeds your brain. A fragment that blocks your eye today can block a brain artery tomorrow. This is not an eye problem. This is a vascular emergency wearing an eye costume. Research published in Ophthalmology tracked patients who had this symptom and found that those who didn't get a rapid vascular workup had a dramatically higher stroke risk over the following 90 days compared to those who were evaluated and treated right away. The bottom line is dead simple. If vision in one eye goes dark and comes back, even if it lasted 30 seconds, Even if it feels completely fine now, you go to the emergency room that same day. Not tomorrow. Not when you can get an eye appointment next week. Today, you tell them exactly what happened and when. The mistake people make is treating it like an eye issue. Booking an optometrist appointment for the following Thursday. By Thursday, the stroke may have already happened. If you take blood thinners, bring your medication list. But the blood thinners don't change the urgency. You still go. Warning sign hack 2, sudden one-sided numbness or tingling. Sandra was 71. Woke up one morning and her entire left arm felt like it was full of static. That pins and needles feeling, shoulder all the way down to her fingertips. She wiggled her fingers, shook it out, and within about 3 minutes it was gone. She figured she'd slept on it funny and went downstairs to make coffee. Here's the problem. Everybody has had a limb fall asleep. You sit on your foot wrong, you lean on your arm, blood flow gets pinched, and you get that tingling. But that kind of numbness builds up gradually. It's clearly tied to how you were positioned, and it goes away when you move. What Sandra had was different in every way that matters. It came on suddenly. There was no positional trigger. It affected her entire side, not just a pressure point. And it resolved on its own without her changing position. The neurology behind this is direct. Your brain's sensory cortex, the part that processes touch and body position on the left side, is fed by specific branches of the right cerebral artery. When blood flow to those branches gets interrupted, those neurons stop doing their job. You lose sensation down one whole side. Arm, leg, face, sometimes all three at once. Blood flow comes back, sensation returns, you feel fine, and you convince yourself it was nothing. The Oxford Vascular Study, which followed over 1,000 TIA patients, found that sudden one-sided sensory symptoms were among the most common features of a TIA, and they were also among the most commonly dismissed. Patients waited an average of 24 hours before seeking any medical evaluation. 24 hours, with a 48-hour stroke window ticking. Here's the rule. Sudden, unprovoked numbness or tingling on one side of your body, especially if it involves your face along with an arm or leg, means you go get evaluated the same day. Period. You probably know the FAST acronym. Face drooping, arm weakness, speech difficulty, time to call 911. But I want to be clear about something. Numbness without any weakness still belongs in this conversation. Don't sit around waiting for your arm to go completely limp before you take it seriously. The numbness alone is enough. The trap people fall into is the positional explanation. I must have slept on it. If it came on suddenly, resolved on its own, and you can't point to a specific position that caused it, the explanation doesn't matter. The evaluation does. Quick checkpoint. We're getting into the warning signs that people miss the most. If this is landing for you, share this video with one person you care about. A parent, a spouse, a friend, over 50. That share could genuinely matter. Like, comment, subscribe. Let's keep going. Warning sign hashtag 3. Sudden loss of balance, coordination, or unexplained dizziness. Raymond, 74 years old. Standing at his kitchen counter one afternoon. Out of nowhere, a wall of dizziness hits him. Not the spinning room sensation you get with inner ear problems. More like the ground underneath him had suddenly become unreliable. He grabbed the counter, steadied himself, and it passed in about 60 seconds. He sat down, had some water, figured his blood pressure probably dipped, and moved on with his day. Here's why dizziness is such a tricky one. It's incredibly common in people over 65. Most of the time, it's completely harmless. Blood pressure drops when you stand up too fast, inner ear crystals get displaced, you're dehydrated, whatever benign stuff. But vascular dizziness, the kind caused by reduced blood flow to the cerebellum, which is the brain region that runs your balance and coordination, can feel almost identical in the moment to those harmless causes. Almost identical. That's what makes it dangerous. The features that should make you suspicious, it hits suddenly rather than building gradually. There's no obvious positional trigger. You weren't standing up from a chair or turning your head quickly. You feel unsteady or have trouble walking. And critically, it shows up alongside any other symptom from this list. The cerebellum and brainstem get their blood from the vertebrobasilar arteries, and when those arteries are compromised, they produce exactly the cocktail of dizziness, imbalance, and coordination problems that Raymond experienced. Here's a statistic that should bother you. A review in the Annals of Emergency Medicine found that vertebrobasilar TIA is one of the most frequently missed diagnoses in emergency rooms. specifically because dizziness is so easily blamed on something else. Patients who came in with isolated dizziness and turned out to have had a posterior circulation TIA often didn't even get brain imaging on their first visit. They got sent home with advice to drink more water. The guidance is straightforward. Sudden dizziness paired with any difficulty walking, any loss of coordination, or any other warning sign on this list, that's an emergency room visit, not a sit down and see if it passes situation. If the dizziness is isolated and clears up fast, you still call your doctor that same day and describe exactly what happened. The deadly mistake is the dehydration narrative. I probably just needed water. Maybe. But if you're over 65 with any vascular risk factors, and you just had sudden, unexplained loss of balance, a glass of water is not a medical evaluation. Warning sign, #4. Sudden speech problems or difficulty communicating. This is the one almost everybody dismisses. And I mean everybody. Because when people picture stroke-related speech problems, they imagine someone completely unable to talk, slurring every word, clearly in distress. That's the dramatic version. But the subtle version? The subtle version is a word that just isn't there when you reach for it. Not a tip of the tongue thing where you can feel the word hovering just out of reach, a total blank. The word is simply gone. Or, you open your mouth, and a completely different word comes out than what you intended. Or you can understand everything being said to you perfectly fine, but you cannot form a response. Your mouth won't cooperate with your brain. These episodes are brief. They resolve. And people universally explain them away as brain fog or senior moments or, I just blanked for a second. Patricia was 69. Talking to her daughter on the phone, mid-sentence. She just stopped. She knew exactly what she wanted to say. She could hear her daughter on the other end saying, "Mom? Are you there?" But for about 30 seconds, the words would not come out. Then, like a switch flipping, they came back. She finished her sentence, laughed about it, and hung up. What Patricia had is called transient aphasia. The language centers in your brain, for most people, those sit in the left hemisphere, are fed by branches of the left middle cerebral artery. When blood flow to Broca's area, which handles speech production, gets temporarily cut off, you get exactly what Patricia experienced. You understand everything. You know what you want to say. But the output machinery just goes offline for a bit. Then flow returns, and you're fine. A study from the American Stroke Association found that transient speech symptoms had the longest delay to emergency presentation of any warning sign. Patients waited an average of over 12 hours. 12 hours. Because by the time they considered going to the hospital, the symptom was gone. And they felt ridiculous showing up to an ER to report something that wasn't happening anymore. That embarrassment cost people their lives. It cost people the use of half their body. It cost people years in rehabilitation. Let me be as direct as I can be. If your speech suddenly fails, even for 20 seconds, even mildly, even if it comes right back, you go to the emergency room. You bring someone with you if possible. You tell the triage nurse that you had sudden speech difficulty, you give them the exact time it happened, and you tell them how long it lasted. That information directly shapes what tests they run and how fast they run them. No emergency physician on earth is going to think you're wasting their time. They want to know about this. A brief speech disruption that resolved completely is still a neurological event, and it gets treated like one. We've covered 4 warning signs, 3 more to go, and they're the ones that tie this whole thing together. If you're still here, you're taking your health seriously, and I respect that. Hit that like button. It genuinely helps the algorithm push this to more people who need to see it. Drop a comment telling me whether your doctor has ever specifically asked you about TIA symptoms. I'm willing to bet most of you will say no. Warning sign. #5. Sudden unusual headache with vascular risk factors. I need to be precise here, because headaches are one of the most common complaints on the planet, and the overwhelming majority of headaches have nothing to do with strokes. I'm not trying to turn every headache into a panic attack. The specific headache pattern linked to vascular events is distinct. It comes on suddenly, not the slow build of a tension headache that creeps up over an afternoon. This one arrives at full intensity within seconds, like a switch was thrown. Some people describe it as the worst headache of their life, hitting peak pain almost instantly. It may come with nausea or vomiting. It may be accompanied by any of the previous 4 warning signs. And critically, it occurs in someone who already carries vascular risk. But warning sign number 5 isn't really just about the headache itself. It's about what the headache is pointing to underneath, and that's where I want to spend some time, because this is where 2 decades of clinical experience narrows down to a single point. The most devastating strokes happen to people who had no idea they were high risk. They weren't being monitored. They weren't on appropriate medication. They didn't know what questions to ask. Let me lay out the major risk factors bluntly. High blood pressure is the #1 modifiable stroke risk factor. The CDC estimates roughly 47% of American adults have hypertension, and close to 1 in 5 of them don't even know it. Blood pressure that stays elevated doesn't give you symptoms. It just quietly destroys your arteries year after year. By the time a TIA shows up, you've got years of pressure-related damage already baked into those vessels. Elevated blood sugar, even at pre-diabetic levels, not full-blown diabetes, damages the endothelium. That's the one-cell-thick inner lining of every artery in your body. It's what keeps blood flowing smoothly and prevents clots from forming. Chronic high glucose inflames and erodes that lining, turning it into the rough, sticky surface where plaque and clots love to set up shop. Data from the Framingham Heart Study showed that people with elevated HbA1c carry significantly higher stroke risk independent of every other factor. Atrial fibrillation, an irregular heart rhythm affecting roughly 2.7 million Americans, with rates climbing steeply after age 65, causes blood to pool in the heart's upper chambers and form clots. When those clots break loose, they head straight for the brain. AFib-related strokes are typically larger and more devastating than strokes from other causes. And because AFib can be intermittent, present for a few hours, then gone, a standard resting ECG might catch it, or it might completely miss it. Obesity and sedentary lifestyle compound every single one of these factors. Excess body weight increases blood pressure, worsens insulin resistance, promotes inflammation throughout your vascular system, and increases the likelihood of developing AFib. A person carrying these risk factors who gets a sudden thunderclap headache is in a fundamentally different situation than a healthy 30-year-old who gets a bad headache after a stressful day. Context determines urgency, and vascular risk context changes everything. The actionable takeaway: a sudden, severe headache that arrives at full intensity within seconds, or one accompanied by any neurological symptom, means emergency room. If you carry any of the risk factors I just described and haven't had a direct conversation with your doctor specifically about stroke risk, that conversation needs to happen at your very next appointment. Not sometime. Your next appointment. Warning sign #6. Sudden confusion or disorientation. This one doesn't get nearly enough airtime, and it should, because it's common, it's frightening, and it gets misattributed to other things constantly. What I'm talking about is a sudden episode where you become confused about where you are, what you are doing, or what time it is. Not the gradual fogginess of being half asleep or medication side effects. A sudden, sharp break from normal awareness. You're in your own kitchen, and for 30 or 60 seconds, you genuinely aren't sure why you're there or what you were doing. The world briefly stops making sense, then snaps back into focus. People attribute this to lack of sleep, to stress, to medication interactions. And sure, those things can cause confusion. But sudden onset confusion in someone over 60 with vascular risk factors can also be a sign of transient reduced blood flow to the temporal or parietal lobes of the brain, the areas responsible for orientation, memory formation, and contextual awareness. There's a related phenomenon called transient global amnesia, where a person temporarily loses the ability to form new memories and may repeatedly ask the same questions for minutes or even hours. While the relationship between transient global amnesia and stroke risk is debated, the sudden onset of confusion in the context of vascular risk is not something you should be explaining away. The takeaway is the same as every other sign on this list. Sudden confusion without a clear, explainable cause, especially combined with any other symptom here, warrants a same-day medical evaluation. Don't wait to see if it happens again. Don't assume it's just stress. Get it checked. Warning sign #7. Sudden severe fatigue or drowsiness without cause. This is the one that connects the entire conversation, and it's the one most people will never hear about until they're already in trouble. I'm not talking about being tired after a long day. I'm not talking about poor sleep catching up with you. I'm talking about a sudden, overwhelming wave of fatigue or drowsiness that hits without explanation and feels disproportionate to anything you've been doing. You were fine 10 minutes ago. Now you can barely keep your eyes open. or you feel like your body weighs twice what it should. Research has shown that sudden unexplained fatigue can be a warning sign of stroke, particularly in women. A study published in the journal Neurology found that non-traditional stroke symptoms, including sudden fatigue, sudden face or limb pain, and sudden onset of nausea, were significantly more common in women than in men. This matters enormously because the classic stroke symptoms that most awareness campaigns focus on, facial drooping and arm weakness, are skewed toward male presentation patterns. Women experiencing a TIA or early stroke may present with fatigue, confusion, or generalized weakness rather than the textbook focal deficits, and that atypical presentation leads to delayed recognition, delayed treatment, and worse outcomes. The broader principle here is critical. Stroke doesn't always look like what you think it looks like. The dramatic Hollywood version, someone clutching their head and collapsing, is one presentation. But quiet warning signs like sudden unexplained exhaustion, especially in combination with other subtle symptoms, are just as important. If you experience sudden, severe, unexplained fatigue, particularly alongside any other symptom on this list, don't write it off. At minimum, call your doctor that day. If it's accompanied by other neurological symptoms, go to the ER. All right, we've covered all 7. If you've made it this far, you know more about stroke warning signs than the vast majority of adults walking around right now. That's not nothing. Do me a favor, like, comment, share this with someone over 50 that you care about. And subscribe if you haven't. Every subscription helps this reach more people who need the information. 3 tests to discuss with your doctor. Let me give you 3 specific diagnostic conversations that are worth having at your next appointment, especially if any of the risk factors I mentioned apply to you. 1. Carotid artery ultrasound. This is a non-invasive imaging test that looks at the arteries in your neck for plaque buildup. These are the same arteries that feed your brain. If there's significant narrowing, your doctor can do something about it before it becomes an emergency. 2. HbA1c blood test. This gives you a picture of your average blood sugar over the past 3 months. It's a better indicator of sustained vascular risk than a single fasting glucose reading. If it's elevated, even slightly, it's actionable information. 3. Holter ECG monitor. This is a device you wear for 24 to 48 hours that continuously records your heart rhythm. It can catch intermittent atrial fibrillation that a standard 10-second EEG in the office would completely miss. If you've got risk factors for AFib, or if you've ever felt your heart skip or flutter, this test is worth asking about. I want to be clear, I'm not prescribing these. Your specific risk profile needs a direct conversation with your own physician. But in 21 years, these are the 3 tests I've seen uncover hidden stroke risk in people who had absolutely no idea they were sitting on a time bomb. The Stroke Risk Clarity Protocol. 5 questions for your doctor. I want to give you something you can literally print out and bring to your next appointment. 5 questions. Write them down or grab the guide linked in the description. Question 1. Based on my blood pressure trends, my blood sugar levels, and my heart rhythm history, what's my estimated stroke risk right now? How does that stack up against the average for my age group? Question 2. Have I ever mentioned or experienced a brief episode of vision change, numbness, dizziness, confusion, or speech difficulty that I brushed off? And if so, does that warrant further evaluation at this point? Question 3. Given my personal and family medical history, would a carotid artery ultrasound be appropriate? If you don't think so, I'd like to understand why not. Question 4. Is my heart rhythm being monitored adequately? Would wearing a Holter monitor for a day or 2 give us useful information we don't currently have? Question 5. If I experience any of the 7 warning signs we discussed, and the symptom resolves within a few minutes, what's the correct response? Should I go directly to the emergency room, or is there a different protocol you'd recommend? Any doctor who's genuinely invested in your long-term health will welcome every single one of these questions. And honestly, if your physician seems dismissive when you bring up brief neurological symptoms you've already experienced, that dismissiveness itself is telling you something. It might be time for a second opinion. Your brain is not a place to gamble. Your 30-day action plan here is what I want you to do this week. Not this month. This week. Step 1. Grab a piece of paper and write down every vascular risk factor that applies to you. High blood pressure, elevated blood sugar or prediabetes, smoking, current or past, known heart rhythm issues, family history of stroke or heart disease, obesity, sedentary lifestyle, history of high cholesterol. Just the list. 1 page. Keep it somewhere you can find it. Step 2. Write down the 7 warning signs from this video. Temporary vision loss in one eye, sudden one-sided numbness, or tingling sudden loss of balance, or coordination, sudden speech difficulty, sudden severe headache, in the context of vascular risk, sudden confusion, or disorientation, sudden unexplained severe fatigue. Put that list on the refrigerator. Give a copy to whoever is most likely to be with you if something happens. Your spouse, your kid, your neighbor, whoever. They need to know what to look for because you might not be in a position to tell them when it matters most. Step 3. Within the next 30 days, bring both lists to your doctor and have the stroke risk clarity protocol conversation. Don't just plan to do it. Write down the actual appointment date today. Commit to it.